everyone, my name is Hannah and today I'm going to be talking about informed consent. Informed consent is the process in which a person agrees to treatment after they are fully informed of any risks, benefits, reasons for the treatment, and other alternate treatment options. This is an opportunity for patients to express concerns, ask questions, and to fully understand the reason for the treatment and what's going to happen during the procedure. It is a legal document and it is also required by the Medical Code of Ethics. This helps protect patients and doctors. Usually, informed consent is a signature on a document, but in some emergency cases, a verbal yes would suffice. And when a patient gives their consent, that is them saying they agree to the procedure, they agree to treatment. It is their yes. Something important to note is that after a patient signs the consent, they are able to change their mind and not go through with the procedure or even ask questions after the consent is signed, but it is their right to refuse treatment. Some procedures that require informed consent are anesthesia, surgery, chemo and radiation, blood transfusions, forceps, or an episiotomy during childbirth. So for my CUSIN competency, I picked patient-centered care because the patients are a big focus in any sort of situation, but especially this, because it is the patients who are agreeing to the treatment. And their values and beliefs need to be respected as long as it's not contraindicated. So an example is a Jehovah's Witness. Jehovah's Witnesses do not believe in blood transfusions, so they're not going to sign a consent for a blood transfusion, but they are still allowed to sign consents for procedures. So the doctors and the nurses and the staff would accommodate to the Jehovah's Witnesses' values and preferences of not wanting a blood transfusion. So as I said earlier, before signing consent, patients need to be aware of the risks, benefits, other options. And the nurse's role in informed consent is witnessing the signature, but it is not just watching the patient sign the form, it is watching that the patient is choosing for themselves to sign the form and that they actually understand what they are agreeing to and that they're not just scribbling their signature on a piece of paper. On the legal side, nurses need to tell doctors if they don't understand anything that the doctor said or if they have questions, even after the consent. It is important for patients to be fully aware. On the ethical side, patients have the right to choose or refuse care, and their choices need to be made because they wanted to, and it is their voluntary right. Usually, consents are signed before going to the operating room, but I know there are some instances where they get the patient to sign it in the procedure room. But no matter where the patient is, nurses need to make sure that the signature is voluntary. I know sometimes getting signatures in the procedure room isn't a common practice because it can kind of sway the patient into signing because everything's already set up, all the staff is here, they're already in the room. So just make sure that no matter where the patient is, that the signature is 100% the patient's choice. So for my BSN Essentials, I picked person-centered care and professionalism. So as I already talked about, the patient is a participant in their care. They choose to go through with the procedure and they make their own choices. So the nursing role in this essential is making sure the patient understands everything, their questions are answered, and they're not being pressured. So an example is a nurse asks a doctor to come and speak to the patient after they ask if there are other options to the procedure. So as I said before, make sure the patient is fully aware of everything. And professionalism. So consent must be obtained before the procedure, and choosing or refusing treatment is the patient's choice no matter if the nurse agrees or not. So the nursing role, speaking up if a patient doesn't understand. So an example is a nurse refuses to witness a consent and notifies the doctor after a patient states that the doctor did not explain the reason for the procedure. So to make sure all the bases are covered before signing the paper. So my reflection question, what action should the nurse take if a patient reports that they have not spoken with a doctor before giving consent for a procedure? And these are my references. Thank you.